Welcome back to the Men's Manual podcast, and today we're continuing our deep dive into hair restoration and hair transplants with our second episode on hair transplants with Dr. Raja, who is the lead hair transplant surgeon at Manual. On the last episode, we spoke about different types of hair loss, different types of hair transplants, who's a good candidate for a hair transplant, and also some of the different treatments you can get before you take that step. If you want to watch that episode, you can click on the episode somewhere around here. Now, today, we're going to be looking at a little bit more at post-transplant. So what to kind of expect, how long it's going to take to recover, all of those kind of questions. So, Dr. Raja, how long does it take normally, and what can you expect over that first 7 days, say, after your hair transplant?
So there's some variation depending on what type of procedure you're having, but I'll start with the FUE procedure, which is the most common one that we do. You tend to find the first 2 weeks are that is the most important time for recovery, and more so making sure that everything's healing well. My patients usually the following day post-op will wake up without any pain or discomfort. They might have some itching in the donor area. That's quite normal. But they go home with a set of aftercare instructions, which we encourage them to follow to the best ability. And that's really important, making sure that they're using the spray that we provide, and also, that they're cleaning the areas appropriately without risk of dislodging or damaging the grafts. So I've run through all of that with my patients individually post-op, making sure they're happy with everything. We also provide medication, and that varies between surgeons depending on what they feel is appropriate for that particular patient. But generally speaking, it might be that you have some antibiotics to reduce the risk of infection, and it may or may not be the case, or you may have some steroids to reduce the swelling, which is commonly seen as well. So you will usually get some swelling post-op. Patients that come to see me in a consultation often worry about this, and they'll show me pictures that they've seen online, people really badly swollen heads. And thankfully, with our patients, generally we don't tend to see that level of swelling. So classically, you see that in patients who've been to clinics abroad, they tend to inject a huge amount of fluid as part of that procedure. But our procedures generally much more discreet, and the anaesthetic is done in a way where patients don't usually feel pain throughout the procedure. It's just the actual injections themselves. So I'd expect a mild level of swelling post-op, and that usually settles down within 4 or 5 days after the procedure. And in most cases, people can't tell that you've had anything done from a swelling point of view within a week. But after 2 weeks, you'll be able to go back to your normal routine, pretty much.
And do you ever get any kind of like bruising that might travel down into the face or anything like that?
Yeah, you can. And it's very rare. I've done thousands of procedures in my list of patients. I've had maybe 2 or 3 that have come back with some bruising, and usually it's around the eyes. It depends on how sensitive the skin is for each individual, but it's very, very rare for that to happen. But you can see it occasionally, yeah.
And I've heard of something called shock loss. I don't really know what that is, but what is it and what causes it?
Yeah, that's a really good question. This is a term it's definitely thrown around a lot, and patients will mention it to me as well in a consultation. Shock loss can happen on its own. So it can happen to anybody for reasons we don't particularly understand well. So we would, in medical terms, call it telogen effluvium. That's a form of shock loss as well. And what happens is the hairs or the follicles tend to go into a state of shock and fall out. So you can experience this sporadic, random hair loss, which can be cyclical and tends to get better and worse, and may level out at a certain point. But also there's shock loss around a hair transplant. And what we tend to find is, sometimes we have patients who, particularly the ones where we see over-harvesting, they'll come back with a large patch of hair missing from, donor area, or it can happen in the recipient area as well. And, one would think that is down to the trauma from the surgery and damaging the actual follicles and perhaps the body's response to that. In some way, maybe like an autoimmune response you'd see with a typical alopecia. But you tend to see basically patches where the hair's fallen out. Now, in my understanding, about 95% of those follicles, will generally tend to recover over time on their own. But there can be permanent loss in 5 to 10% of cases. But thankfully, if the procedure is done well, you tend not to see shock loss, but it can definitely come up around a hair transplant, and it can come up on its own. The important thing is that it's managed effectively.
Pretty rare if it's done properly. But if you over-harvest, that sounds like one of the main reasons that you could end up with that.
Yeah, I mean, the mechanisms for shock loss are poorly understood. Like we actually don't know specifically why it happens. So all we can do is mitigate the risk to some degree. And I, as a surgeon, when I'm doing a procedure, I'm mindful of that. I'll give you an example. When I'm harvesting, the angle of harvesting, we're working to a fraction of a millimeter. And if your angles are off, and if you're actually transecting or damaging the follicles, that may trigger a response from the body. So that's a potential trigger. And when we're making the incisions where the grafts are going to be going, if we're careful not to damage the existing hairs, in my opinion, that would reduce the risk as well. So if we can reduce those trigger mechanisms, the potential for shock loss, thereby, we would be reducing that as well.
Right, very interesting. And what's the kind of timeline then for full recovery of the kind of scarring, I guess, or the actual surgery?
Yeah. So 2 weeks post-op, all the scabs should have shed by then. And if you have remaining scabs, there should be very few at that point. So I normally say to my patients, after 2 weeks, you can go back to your normal routine. But the downtime with FUE procedures nowadays is very little. You can actually, maybe from 1 or 2 days post-op, just do your day-to-day things as long as you're careful and you take precautions. A lot of people work from home these days, and you probably be fine to do that. But we normally say take a week or two off work, just to avoid any stress, on the grafts or any environmental issues. But yeah, 2 weeks, you go back to your normal routine. And there's certain precautions beyond that, like you don't want to have prolonged sunshine exposure for long periods, because that can obviously, if you've got sensitive skin, it can burn easily, and if we're transplanting into that area, it's going to be more sensitive. So you take certain precautions, but 2 weeks post-op, you'll be back to normal.
Is there anything else that you have to avoid post or close to post-transplant? I don't know, something like wearing a hat or damage to the site, trauma to the site, I should say.
Yeah, I mean, all the aftercare instructions, aside from the cleaning instructions, are really centered around making sure we're protecting the grafts. So if you look at sleep position, for example, I normally recommend about 45-degree angle to sleep in that position for the first 5 nights. We give you a neck pillow to go home with, and that's to brace your neck so you're not rolling around in your sleep, and that can put stress on the grafts if you rub them against anything. Taking precautions when you're moving in and out of a car, because you can scuff your head on the way into a car. We talked about this earlier, right? That actually happened recently to a patient of mine. But it does occasionally happen. I do warn patients about that because they don't have the spatial awareness because of the anesthetic. So they're getting into a vehicle, they don't actually know where their head is, right? And therefore, they don't have that gauge of where it's going to make contact. So you just got to be really careful. And I think in terms of being careful around wearing headgear, you mentioned can they wear a cap? They can wear a baseball cap if they're very careful and it doesn't rub against the grafts from 1 week post-op. So I tell my patients 1 week. Some surgeons will say 2 weeks to be extra careful, and that's absolutely fine. But I normally suggest that they wear a high front baseball cap which sits on the forehead and does not come into direct contact with the grafts. So it's going above and over.
Right.
Then it's fine. But no woolly hats or anything like that for 2 weeks.
So it's best to get it done probably in summer sometime, and then.
Yeah, I mean, it's so variable. Like people have, different commitments, lifestyle issues, and like we tend to see classically in summer holidays, we tend to see a lot of school teachers getting it done at that time,
right?
Or academics, because that's the time where things are quiet for them. But the busiest time of year for us is lead up to Christmas period, because people tend to have Christmas holidays. And, if they're discreet about the procedure, then they don't have to take time off around that time.
Great, so they can just come back and suddenly have a load of hair.
Absolutely. And then, feeding into what you mentioned earlier about, different types of procedure and recovery, like important to note with FUE, we don't always shave the full head. So we do part shaven procedures sometimes. I tend to do unshaven procedures in some cases. Typically, our celebrity clientele would opt for procedures like unshaven or line shave technique, where there's very minimal visibility and they can be discrete. So important to note, there are options available where you can actually get back to your baseline relatively quicker. But we'd have to assess you to see if you're suitable for those options depending on the graft requirement.
So how long until the graft is actually kind of visible and looks natural, I guess? So how long until it's fully grown out and, ready to be shown to the world?
I think, when we actually implant the follicles, they have a very tiny bit of length on them. And in some cases, we do what we call a preview or long hair FUE. But vast majority of people, we have a small amount of length on those grafts. Now, usually what happens is once the grafts have healed, the scabs have shed, some of those scabs will take the hair with them. And that doesn't mean that the graft has fallen out. It's just that the hair shaft itself that sheds alongside the scab. So you do get some shedding in the very early phase, but the ones that are healed and the shaft remains, you'll have a very small amount of length, which will gradually get a bit longer. And then you tend to go through a shedding phase around sort of 6 to 12 weeks post-op. And what people refer to as the ugly duckling phase, which then begins at that point. And that's where you tend to shed a lot of those hairs that we've implanted. So people have, this period where they see a little bit of growth and then it falls out. And they tend to panic at that point, and that's very common. But beyond that, actually, you tend to get fine growth coming in around 3 to 4 months post-op. It gets gradually thicker and thicker up until 12 months. So I normally like to see you at 6 months to make sure everything's going in the right direction. See you again at 12 months to make sure we're happy with the outcome. And if there's anything else we need to be doing at that point, we can always consider it.
You probably notice some kind of progress after 6 months then, but to get the full kind of thickness back to the hair, it's 12 months.
Yeah, I mean, important to note that, the majority of the case studies that we have on the website are actually 6-month results, because people tend to come back at 6 months with a fantastic result a lot of the time. And, when they subsequently come back for the 12-month appointment, we add more pictures on. But most people at 6 months tend to have really good growth, and it could be maybe about 70% on average. But between 6 and 12 months, there's a considerable amount of growth as well. So sometimes we see patients at 6 months and the growth isn't up to where we're expecting from a good result. And I wouldn't be panicked or worried about it at that stage. I would bring them back at 12 months and then assess an improvement. And more than 90% of the time, there's a significant improvement in those between 6 and 12 month period. Yeah.
And in how many patients do you see that they have one hair transplant, and then maybe they come back to you in 5-10 years time and get a second one done?
I've had a lot of patients who have come back for another procedure down the line, and it's always nice to see those patients again. I think the important thing is maintaining stability the best you can, and like we mentioned earlier about medication, we can only control it to a certain level, but over time people will regress and lose more hair, whether it's in the hairline or the crown. And I always counsel patients on that when they're coming to me for a procedure. I'll say that if you're having one, chances are you're going to need another one at some point. What we want to do is lengthen that out as much as possible. But patients will come back for further procedures down the line. And that's why it's really important when we're doing the harvesting, we're not over harvesting in the first instance, because it means we can go back into the same donor area, take a good amount of follicles for the second procedure when needed. And
you've mentioned a couple of times about post-transplant kind of treatments or options to make sure that you keep those hairs. What kind of things can someone do to maintain it as best as possible?
So again, medication is a key here. I normally advise them when to stop the medication around a transplant, and we always give you that information beforehand. But I would highly recommend considering medication alongside a transplant. It's a difference between a good result and an outstanding result. So that's the first thing to consider. And then, dietary considerations are really important, because quality of hair is important for good growth. So I would normally recommend, if there's any suspicion of a dietary deficiency, I normally pick that up in the consultation, but a good multivitamin supplement, to make sure that the vitamins are topped up, they're eating healthy, regular exercise. These are all important considerations, and they help towards getting a good result.
Are there any particular supplements that help? Like things, I hear things like biotin being thrown around, those kind of things. I don't know if they're effective or not.
I would definitely say so. Yeah, I think biotin is really important from again a basic nutritional point of view, because you need to provide the building blocks for good quality hair. So if we're taking good supplementation, biotin being the more recognized one for hair quality in particular, I would always recommend that. But a good multivitamin is really important. I mean, I've seen patients where a vitamin D deficiency has led to poor quality hair and some degree of hair loss. So that's something that's relatively common, and people are often unaware that they've got low vitamin D levels. So the pattern of loss you see with those patients is usually different to what we see with typical male pattern loss, as you know, but there's usually overlap between those two conditions. And you tend to find if they've got really fine, brittle quality hair, and you look at it and you think, well, there's something more to this. I'll often send them off to the GP for some blood tests, if necessary. But I'd definitely recommend a good quality multivitamin supplement, or taking biotin supplement, or something specifically for hair loss, which may have zinc, magnesium, other factors in there as well.
Okay, very interesting. I wouldn't have thought that it would make that much of a difference, but I imagine it's still fairly rare, like a kind of deficiency in that's going to affect the hair.
Yeah, I mean, it's unlikely to see a deficiency, with biotin, but people don't test for it. So, it's similar, like, I guess, like testosterone. A lot of time, people don't test for it. They don't know if they've got a low testosterone, or they might benefit from the treatment. So if there's a suspicion of anything in the consultation, we might send off for some blood tests, but that's usually looking at things like thyroid dysfunction or diabetes or something that might be underlying.
So if you have a patient come back after that kind of 12-month mark and it just hasn't really worked very well for them, I'm sure there are different kind of circumstances, but what can you kind of do to help there? What do you offer in those kind of circumstances?
So it depends when they're coming back. So a 6-month review, I wouldn't be concerned if their growth isn't up to par. There's no set rules to say at 6 months you're expecting 60% growth or 70%. Everybody's different. I've seen cases where I've seen people at 8 or 9 months and the growth isn't very good, and they've come back at 18 months and it's coming really thick, right? And there's others where at 6 months you see almost full growth, 90% plus potential, what we're expecting. So there is a massive variability there in some patients, but the average at 6 months, you tend to see it's going in the right direction. So I always say to patients, we just want to see it's going in the right direction at that point. And what I'm looking for at that 6 month review is to see that the donor has healed up well enough, should they need further procedures. And usually at that point it's healed. I mean, even within a few weeks post-op, the donor's healed to a point where it's not obvious. So usually at the 6 month mark, patients are happy with the growth to the point where they're content and happy with the procedure overall. But I always recommend the 6 month and the 12-month visit. The vast majority of patients will attend for the 6 month, and then 12 month, if there's any concerns about growth, we can always review at 12 months. If there's a case where we've got something like graft rejection, where the grafts haven't taken particularly well for some reason or other, and that can very, very rarely happen if procedures are done well. You would have to assess that and see, try and find an underlying cause. It might be somebody, for example, who's got undiagnosed type 2 diabetes and it's poorly controlled, let's say. And there's usually something that's going to be the cause. You don't tend to see that in somebody who's fit and well.
So it's very rare then for that to happen.
Oh, absolutely, I would say so. Yeah. I mean, you tend to see it, like I mentioned earlier, with poor technique and things like that. But if the procedure's done well and it's unremarkable in terms of the actual procedure itself, there's nothing untoward, you wouldn't expect that.
So generally for you in your practice, it's extremely rare then, sounds like.
I would say so, yeah. I mean, if there's anything that's a potential risk, we normally vet the patients very well beforehand. They go through the consultation having had their medical history disclosed in a form, and I would obviously overlook that and just look through it, and go through it with the patient in the consultation. But yeah, the important thing is medical history is thoroughly explored in the consultation process. If there's anything that can impact the results, it's important that we discuss that with the patients and they're aware of the outcomes.
And you've touched on a few of them, but what are the main reasons or kind of like medical conditions that might cause the hair transplant not to take as well as expected?
Yeah, so I mean, typically a good example would be poorly controlled diabetes. So my patients and we do treat diabetic patients all the time, but we have to make sure their markers are below a certain threshold for it to be safe and for the risk to be low. And I tend to follow the NHS guidance for minor surgical procedures. But they normally provide us with a blood test that covers sort of 3 months worth of blood sugar readings largely.
Right.
And that gives us an indication of how well controlled the diabetes is.
So now we're going to get Dr. Raja to bust some common hair loss or hair transplant myths for us. So the first one is you can transplant hair from someone else onto your head.
Funnily enough, I had a patient 5 or 6 years ago who came to see me with his son, and he'd managed to convince his son to donate follicles, and he said, would you do a transplant from my son to me? And obviously we didn't do it because there's a high risk there, and the risk being that the follicles we take out, we implant them because it's not it's not a match as such. The body would reject them, so it'd basically be a failed transplant.
The same as like organ donation, right?
Exactly, yeah. So in theory, it's possible to do that, but if you had a kidney transplant, we'd have you on a whole array of medication to reduce your immune response. But for hair transplant, we can't justify doing that, so we don't do it. But in theory, it can be done. But yeah, we don't tend to do it.
Not worth the risk.
Yeah, not worth the risk. Absolutely.
All the meds. And then the second one was, can you transplant hair from other parts of your body onto your head?
Absolutely, you can. I've had some cases where we have done that, but I mean, my way of doing this and my opinion is, you should always look to do that when all other options have been exhausted. So I would always opt for scalp donor before I look elsewhere. If we looked at chest and beard hair, for example, it can be used. I had a case where we did a correction on a patient, had very, very little scalp donor hair left because he'd had a few bad surgeries. So we took some grafts from under his chin and actually from the chest and back, and we were able to get him a reasonably good repair on that transplant. So you can, in certain circumstances, use those hairs, but the use has to be justified, in my opinion. You have to be very careful.
Great. And then the third myth is that once you've had your hair transplant done, that's it. Great, you're sorted for life. No more problems.
Probably about 8 or 10 years ago, that was a very common theme that used to come up in consultations, and hair transplants come a long way in a very short space of time, and actually people are a lot more educated about it now. So I used to have this conversation with patients. I used to think, I'm just going to have the one procedure and then that's it, and that's gone from patients being a lot more educated about long-term potential, which is a really nice thing to see, because it helps in the consultation. They understand the process, they understand the progression potential. But yeah, of course, we know that it's not a one-stop solution for the vast majority of people. But that attitude, or that changes. We've seen that in the last 4 or 5 years, particularly, where people are a lot more educated about it. And again, very nice to see that.
Thank you, Dr. Raja. Hopefully we've managed to bust some myths there. And if you have any questions at home about hair transplants, hair loss, anything like that, please leave them in the comments below, and we will try and answer them for you. If you liked this content today, then please give it a like, subscribe to the channel, because we've got lots more interesting guests coming on to talk about men's health problems. Otherwise, thank you very much, Dr. Raja, and hopefully see you again soon.